Pregnancy and childbirth is tough. Okay, so it exacts a big toll on a woman's body, and sometimes we need a little help to get back to feeling ourselves. So, as a mother and a physical therapist, I feel that every woman should know her rights to receive physical therapy as a new mom. So, specifically, women's health physical therapists, we are dedicated to helping women get their body back after birth. We work with conditions such as pelvic pain, back pain, bladder leakage, bowel issues, pelvic prolapse, C-section scar pain, diastasis, and many other ailments. And so we are here to help you feel yourself again. So you may be unaware that physical therapy could help you after you deliver, and I'm here to tell you that you are not alone. It's okay. Many doctors are unaware that physical therapy can be a helpful thing for a postpartum woman. So unfortunately, as part of their med school education, doctors receive very little education on how physical therapy can help their patients. Oftentimes it's one lecture on one day, and they talk about all different types of allied health fields and how they can help. So it's not a lot of time. So they are not necessarily the most aware as to how beneficial physical therapy could be for a new mom. So you may have to advocate for yourself. So don't assume that if your doctor didn't tell you that you needed physical therapy, that it's something that you don't need after you deliver. So hopefully after today's video, you will have a better sense of some things that maybe you should be asking to go to physical therapy for to try and help you out. So here to tell you there's good news. You can advocate for yourself. So I'm going to give you some of the tools you need to get physical therapy after you deliver on that. So one of the best things that you can do is, if you are still currently pregnant, talk to your doctor and see if he or she refers to physical therapy after giving birth, and just start that conversation early. And if you're already dealing with back pain or pelvic pain, don't wait until afterwards. There are many, many things that a physical therapist can help you out with so that we make your pregnancy as comfortable as possible. And we want to lay the groundwork for a good delivery and a better recovery afterwards. So if you're dealing with pelvic or back pain while you're pregnant, don't wait. Seek out care from a physical therapist during your pregnancy, but also kind of laying the groundwork for what to do afterwards as far as seeing a physical therapist. So if your doctor kind of questions why you're asking about seeing a physical therapist after you deliver, I'm going to give you kind of 4 reasons that you can put out there as far as what you want to make sure happens or doesn't happen. So 1, you could be wanting to work with a physical therapist to make sure that you manage any bladder or bowel issues. So it is not uncommon for women after delivery to have some bladder leakage and or some fecal leakage or urgency issues. And these are things that can be managed. Several studies have shown that correct performance of pelvic floor muscle strengthening, as well as engaging in better support activities of the muscles around the pelvic area, can make a big difference on what type of bladder leakage that you may be experiencing, and can help to minimize that leakage and get rid of it quicker. So again, it's not uncommon to have bladder leakage in the first couple weeks after delivery, but that should go away rather quickly. And so if it's not, we definitely want to make sure that we're doing something about it, because the earlier we do something about it, the quicker we can make a change with it. So it's not something to live with. If your doctor's telling you, oh, you just had a baby, it's normal. It's not normal. It's common, but it's not normal. So please know that there are things that you can do, because you're already dealing with enough diapers with the newborn. We don't need to be dealing with diapers for yourself. All right. Second thing that you may find that you need physical therapy for is to prevent scar tissue adhesions or pelvic pain issues. So Whether you've delivered vaginally and had an episiotomy or a natural tear, you may have some scar tissue that develops in the vaginal canal. Or if you've had a C-section, you're going to have an abdominal scar. And for most people, the scars heal up great and do well, but some people, the scar tissue can really kind of get stuck and not move the way that it needs to, and this can cause pelvic pain, pain with intercourse, make it difficult to feel like you can get back to having sex with your partner. It can cause low back and abdominal pain as well. So just because a scar has healed does not mean that it's moving well. And physical therapists are great to partner with to help get things moving. And there are many things that you can do to help desensitize the scar and get it moving better. So getting evaluated to see how your scars are doing after you deliver is another way that a physical therapist could help you out as a new mom. The third way that a PT could help you out after you've delivered is to help manage or prevent low back pain. So it is not uncommon that after you deliver that you are dealing with honestly low back, mid back, or upper back pain from all of the additional lifting and carrying and new movements that you're doing. And that can be quite a toll on your body, be hard to deal with. And so if you can work with or partner with a physical therapist to make sure that you are using your muscles correctly, then it's going to make taking care of that newborn so much easier, because you're not going to be also having to deal with pain at the same time. So we want to make sure that when you are experiencing back pain that we kind of get to it quickly so that we can make a positive change on it as fast as possible, so that you can get back to hanging out and cuddling and snuggling with that newborn and not having to worry about what kind of pain your body's in. The fourth thing that a physical therapist can help with when you are a new mom is honestly wellness for future pregnancies and just your daily life. So I work with many women who have delivered and maybe have had a traumatic birth or delivery and are worried about what's going to happen next time because they plan on having more children. And so by getting an early start on helping their body to recover and get into an optimal place, then they are off to a better place for their next pregnancy. So making sure that the muscles, the pelvic floor muscles, the abdominal muscles are strong and supple and moving the way that they should be, making sure that the scar tissue is moving the way that it should be. All of these things are good things to get accomplished to make sure that you're comfortable not just in your day-to-day life, but you're in a good place for future pregnancies. The other thing that I see in regards to this is more on the side of returning to more fitness activities and feeling comfortable with that many new moms are very leery about what it's going to feel like to get back to exercise, and they want to make sure that they're doing things correctly. And that is one of the areas that probably physical therapists can help you out with the most, is to make sure that you are engaging and using your muscles the way that they were supposed to be, so that you get the most benefit out of the exercise program that you're doing. So we don't want you to be scared to move. We want you to get out there and be active, but we also want you to make sure that that exercise program is effective and working out your muscles the way that it should be without putting extra stress and strain through your body. So a physical therapist can really be helpful in that situation to make sure that you are doing things correctly and safely as you return to your fitness activities. So there you have it. Those are the 4 things that all new moms should potentially be asking for a referral to physical therapy for, to help out after they've delivered. So as a quick recap, after delivery, a physical therapist can help you manage or treat bladder or bowel issues. We can help prevent scar tissue adhesions and eliminate pelvic pain. We can help manage or prevent low back pain. And we can help you feel well and be ready for future pregnancies and to exercise and move the way you want to without fear of pain or problems.